Hello, this is Dr. James Legbele. Welcome to this our channel, which is the 6 domains of health, where we bring you the holistic information that will help you in your health transformation program. This channel is about health transformation hub, and we hope to see you regularly. And if you haven't subscribed, please subscribe, share this video with your friends on social media. I will really appreciate because as you know, knowledge is power, and we have to do everything possible to make sure that our people are well informed. So today's topic is about why do you need health literacy? And I'm Dr. James Alegbele. I've been a consultant for the last many years in the UK, and I've seen, as a consultant physician, I've seen so many people having different challenges, and then eventually many of them passing on. And I felt that it is important to try and share what I know from my own research, as well as in a practical way what I do, not just as a doctor, but as a life coach, and as well as helping people to embrace health transformation. Why do we need health literacy? So this is so important because over the years we have seen increasing pressure in A&E healthcare. Many of the programs we have not really worked for everyone, because everyone needs is different. For example, you might see somebody, the current smoking cessation program may work for one, but may not work for the other, or the reason as to why. So what about the 6 domains of health? We offer to our customers the most comprehensive, supportive, and complete health consultancy, health coaching, as well as mentoring services around self-care and lifestyle management at an affordable level of those with unmet needs in the society. And we help our customer to transform their health and longevity. So let me give you a true life story. I was in a position whereby I saw a gentleman very wealthy, and he really was very curious and said, I didn't know he would have try and find out more, because he was so shocked when I told him that have you been maintaining a healthy life program? He said yes. And then he said, if that's the reason, why did he also end up having so many diseases? And I asked him, what have you been doing? He said, he registered, he has a health coach, and also he has a nutritionist, as well as he has a health coach in terms of exercise program, and has subscription to gyms. I said these are very important aspects of health, but it was very shocked to me that you realize that what you've been doing is just only around physical health program, which is just about 10% of what you ought to have done to maintain healthy life, because you have failed to understand the concept of other domains of health. So the key learning today is we're talking about health literacy, and a glance at as extensive research that has been done into this topic, and then translation of evidence to the population, and the problem of health literacy in our society, and then the effect of intervention using multi-design features and outcomes, and the impact of health literacy, and how health literacy can be a benefit to you as one of our listeners today. So why do we need this program? Because when you look at the problems facing the global health, you will realize that we are facing a very precarious moment to mankind. While we improving technology, it seems less and less resources are being used in terms of money. The healthcare cost is rising, and there are so many people living longer but with so many incurable diseases. For example, the world population is at 7.8 billions, and then we have experienced in the year 2019 and 2020, we have experienced the most devastating COVID-19 pandemic. And notwithstanding, we're still seeing for about 42 million people dying every year due to non-communicable diseases. And the majority of these, 33% of which are cardiovascular disease, and 18 are communicable maternal, perinatal, and nutritional problems. And we're also seeing patients with incurable 17% dying from cancer, and 8% from respiratory disorders, and 3% from diabetes, as well as 8% from injury-related, and the rest are other non-communicable disorders. So what other issues are we facing? Harmful alcohol misuse in some areas. For example, in the UK, you see many people faced with chronic alcohol, despite the alcohol cessation program available, and some of them have found it not useful or not impactful to say. And also, we have people with physical inactivities, working from home, and also tobacco misuse or use, and then diabetes, hypertension, obesity, as well as nutritional or poverty problem. So evidence around health literacy has changed through systematic reviews, which is studies to bring all research evidence together, and then also things like what we call randomized controlled trials. And then what do we know? We know that, for example, 80 million Americans have limited health literacy, and this is not only just limited to the United States, but also in Europe and United Kingdom. Then we have good quality evidence that intensive self-management intervention reduce emergency department and visit and hospitalizations. So low health literacy has been associated with worse health outcomes. Then health literacy is a significant global problem because low health literacy is a significant problem in the United States, affecting 36% of adults, and also low health literacy has been linked to poorer health outcome. So intervention for individuals, health literacy is the degree to which individual can obtain, process, and understand the basic health information and services they need to make appropriate health decisions. Health literacy significantly impacts health-related outcomes such as we've seen in HIV, and a few health literacy interventions have been developed specifically for pregnant women. So there are differences in health literacy level. Differences may exist and then consistently associated with increased hospitalization, greater emergency care use, lower use of mammography, lower receipt of influenza virus, and then poorer ability to demonstrate taking medication appropriately, and then poorer ability to interpret labels and health messages, and among seniors, and poorer overall health status and high mortality. So in putting together, you could see that the effect of interventions using multiple design features and outcomes may be related to, within the health literacy, may be related to increasing the knowledge of our people, of our population or individuals, or increasing the behavioral skills of people, as well as health-related skills that they can use in managing their health illness. For example, if somebody is stricken by flu, it is important that the person has a good health literacy to be able to know, even when you're buying over-the-counter medication as remedies to try and use to curtail the rapid progression of such flu. So just doing nothing can make somebody end up in intensive care unit, even just by a flu attack. So it's important that we, as people, to know what to do at the right time when you are attacked by an illness. And then understanding of what to do, what steps to do, may also help people from going to emergency care department thinking that that is the right approach. And then it will also impact on self-management, self-care, and many others. So the impact of health literacy, low strength for preventative screening, access to care, self-efficacy, behavioral skills, adherence to medications, quality of life, cost, skills in taking medications. So how can health literacy be a benefit to you as listener? So a better comprehension of information can be derived through health literacy, and then health-related skills can be impacted into you. And also this will reduce the emergency department visits, less hospitalization, improve health outcomes. It can affect overall cost of care, and also reduce what we're facing in our society today, which is health inequalities, and also improve efficient use of healthcare services. As I said, there are many who really don't need to go to A&E, but you see them seeking A&E help because that is what they already know they should do by appearing in A&E, which is very good to do, but at the expense of which we overburden the acute services. So how can we help you? Health literacy through the 6 domains of health. What we've done is we've put together relevant information so crucial around the 6 domains of health, and then to try and give you the explanation of how we exist at tripartite. Although this might be contrary to what you already know before, that we don't just exist as physical body, but as 3 bodies in one. So, and the separation of these 3 bodies is difficult, and knowing those 3 bodies are difficult without you being taught. And then evidence-based interventions, interlinks of the 6 domains, and then increasing knowledge, and then health behavioral skills, self-management, as well as health self-efficacy. So, and if you really enjoy or you want to undertake this course, we already provided the website for you, which is www.6dofhealth.net, and then you can subscribe through our sales page there. And also, you can touch base with us to inquire about our new health literacy program, the 6 domains of health course, as well as other modules which are available on our website at www.6dofhealth.com. And you can also get a coaching program through our partners. And then if you also want to improve your the 6 domains of health, how you can impact your lifestyles, you can also email us at admin@6dofhealth.com. Thank you for joining our membership, and thank you for listening to this channel again, and we hope to see you very soon. And I'll see you again next week on this same channel, and wish you the best. See you again. Take care. Thank you very much for attending, and we look forward to the journey ahead where you can turn your vitality into reality. Thank you. Bye-bye.